What's up, you guys? Welcome back to my channel. For those who are new here, my name is Margaret and I am in an accelerated nursing program. I have just finished my first 16 weeks and I have just about a year to go before I can sit for the NCLEX and become an RN. So this is a second degree for me. I already have a bachelor's in journalism and communications, and my life in advertising just wasn't doing it for me. So I decided to go back to school and pursue my dream of being a nurse. And I have to say that it is the best decision that I ever made. And if you're someone who's here to learn a little bit more about nursing, I can tell you with confidence that if that is something that you feel you're passionate about, there's no better decision that you could make. When I was deciding to go to nursing school, I did a lot of research about nursing. I wanted to know as much as possible before making this decision, especially because it was a second degree. I felt like, this is kind of it. You need to make the right decision and keep moving forward, or at least get close, so that your career path is aligned with your education. So I asked a lot of questions. I watched a lot of YouTube videos. I listened to a lot of podcasts. So today's video, I'm going to talk a little bit about nursing careers and education levels and the different certifications you can get. When I was thinking about nursing school, I talked to a family friend who is a longtime nurse and works in education at this point, and I was just asking her for some advice. I didn't know a lot about nursing. I had no idea the hundreds of different paths a nurse could take. And the one thing I asked her was, what is my trajectory for this career? Like, I am a passionate, driven person. I want to be able to continue to grow, take on leadership roles. I want to excel in my career, and where can I go as a nurse? Like, where is my end point, kind of? And she was saying that, nurses are all over the place. They're in government, they're CEOs of hospitals, they're at the bedside, they are everywhere you look, and they're running things. So today I wanted to give you a little taste of all the possibilities that a nurse has, and this is really just scratching the surface. I tried to pick out some things that I don't really hear about a lot in terms of like certifications and potential careers. And if you see one you like, definitely do a little more research and comment down below if there is another specialty that you're really interested in that I didn't cover today, or if you heard one today that you want to learn more about. So let's get into it. All right, I got my handy dandy notebook. I did a lot of research so you guys don't have to. Let's start with, where do nurses work? So you're gonna see basically two categories of nursing careers: indirect patient care and direct patient care. So direct patient care is probably what you think of when you think of nursing, and that is at the bedside. So you're working on some kind of unit and you are working directly with patients. Indirect patient care is something that you might not think of when you think of nursing, and that can be administrative roles, management, coordination roles, and that has a lot to do with the more administrative side and collaboration between different healthcare providers. Okay, so let's talk education. There are many degrees that you can get throughout your nursing career, but first you have to start with either an associate's degree in nursing or a bachelor's of science in nursing. So I will say right off the bat that hospitals are moving to prefer BSN nurses, just looking for that level of education and trying to round out their nursing staff with BSN educated nurses. That being said, an associate's degree is a 2-year program. You go through the program, you take the NCLEX, and you are an RN. If that seems like it's the right path for you right now, an associate's degree is more attainable at the moment, then you can absolutely do that. And then when you are working, a lot of hospitals have RN to BSN programs for our associate's degree nurses, and a lot of times they pay for it. So keep that in mind. If you're not ready to get your bachelor's yet, it's just not in the cards for you, you can always go and get that associate's degree and move on to your BSN at a later time. So the average salary for a nurse with an ADN is about $27 an hour. And you'll find these nurses in all the places that you would find a BSN, RN, or another nurse. So the ER, the ICU, labor and delivery, the OR, these nurses are basically indistinguishable from a nurse with a BSN. Where the differences come is your potential growth if you want to advance your practice. So just quickly, the BSN is a Bachelor's of Science in Nursing. So just like I mentioned, this is very similar to an associate's degree, except for you have a little more leeway and a little more growth opportunity. You have a couple different pathways for this. You have the traditional 4-year nursing program. You have the accelerated BSN program, which is what I'm currently in. And there's the RN to BSN program that I just mentioned. So there are many, many, many ways to achieve your BSN, and if that is something you want, there shouldn't be any reason you can't get it. The average salary for a BSN nurse is $67,000 to $77,000 a year. I am going to be mentioning salaries throughout this video, but please keep in mind these are just national averages. Many, many, many things go into determining somebody's salary. But that being said, it is extremely important to know the going rate in your city, in your town, when you go to apply for a job, because that you should be paid competitively, and you shouldn't be afraid to ask to be paid competitively. Nurses are extremely in demand right now. They're clearly coming to the forefront of the healthcare setting, and I think more than ever, people are realizing the value nurses bring. Hopefully we can continue to grow that understanding and the appreciation for nurses, but you should know your worth and you should be compensated fairly. I think a lot of people think when they're in nursing that they should be doing this out of the goodness of their hearts, and it's not about the money, it's about helping people. And yes, absolutely, I don't actually think you can do this career without having a passion and wanting to do it for the people, for your community, to help people. I think you absolutely need that drive, but you still deserve to be paid fairly and well. Okay, that is enough of that rant. I just have a passion for especially women getting what they deserve and asking for what they want. So we have our associate's degree in nursing, we have our bachelor's degree in nursing, and if you want to be an advanced practice nurse, you can get your master's of science in nursing and your doctorate of nursing practice. So each of these advanced practice degrees can get you into different careers, and there's a lot of possibilities with these. And don't quote me on this, but I don't believe you need a master's in nursing to get a doctorate in nursing. I believe some advanced career paths require either or at least that is what I understood from what I read. But again, I'm just a girl on the internet. Verify those facts before you make any assumptions, but I'm pretty sure. Okay, so we have our education levels, we have our associates, we have our bachelor's, we have our master's, and we have our doctorate. Now let's talk about some careers. Let's say you want to go into nursing, but you don't know if you want to get your master's or your doctorate, which is absolutely fine. It is not required that you get to the highest level of education. There are plenty of ways to specialize and gain more knowledge with your BSN through certifications. So I pulled some certifications that I thought were really interesting and that I didn't really know existed to try and talk about some things that, you know, you don't always hear about. I feel like in nursing school, you're gonna hear about the basics. So like med surg, ER, peds, like ICU, stuff like that. So I just tried to find some more niche career options so you could kind of really see exactly how much is out there for a nurse. Like you name it, anything you're interested in, you can almost always get certified in it and like just blow it up. So the first one I found was a blood and marrow transplant certification. So these are nurses that are going to help pre and post transplant, and this is something you can do without a certification because you are going to actually need 2 years of experience in this field to become certified. But the certifications I'm talking about are a way to deepen your knowledge and really become like an expert in that field, which can advance your career, increase your salary, and make you really the go-to person in your facility for that specific area. Another one I found was a certified breast care nurse. I had absolutely no idea this existed. So this is a nurse that works with patients who have been diagnosed with breast cancer. This could be great for someone who has a close personal relationship with breast cancer and wants to help other people who have been diagnosed with it. This is great for someone who wants to work with women. This is great for anyone who is interested in oncology in general and wants to work with these types of patients. A certified breast care nurse will have specialized training and knowledge of breast health, of diagnosis and staging of breast cancer, of the different treatment options, resources that are available to patients, and also end-of-life care. So these nurses are really going to be with their breast cancer patients all the way through. And they'll see a lot of patients, you know, through their whole journey and really build relationships with those patients, I imagine. But you could be a board certified emergency nurse. So if being in the ER is your thing, if you absolutely love like the rush of being in the ER, you want to be certified in emergency medicine, if you love trauma and like that's just where your jam, then I would say that finding some kind of board certification in emergency nursing would be a great option for you. So the next certification I had not heard about until I did this little project. That is a sexual assault nurse examiner. They call them SANE nurses, and they are specifically certified in this, and they're trained to perform forensic exam. They are the first point of contact for any survivors that come into the hospital. These nurses need to not only be able to perform these exams, but be a source of support for these survivors. Also, they are trained to testify in court. So this is a very unique specialty and training that these nurses get, and they are able to work with their patients and let them know their options and be a source of care and comfort after a very, very traumatic experience. The SANE certified nurse makes an average of $46,000 to $90,000 a year. That is an extremely wide range, and that's going to be due to your location and the need that your facilities have for this type of nursing. Another certification, you can be a board certified nurse coach. So this is great for any nurses where like health and wellness is your jam. You want to help people live the healthiest lifestyle as possible. You want to work one-on-one with a patient and kind of coach them through their exercise, diet, eating habits, give emotional support and recommendations for, just living kind of a holistic, healthy lifestyle. And then we have our hospice nurses, and there are several certifications you can get in hospice nursing care. They make anywhere from $49,000 to $82,000 a year. This depends on what certifications you have, area, etc. So these are nurses that care for terminally ill patients. You are going to allow them to die with dignity in their own home and comfort. This is a very important job. Death isn't something that a lot of people like to talk about. It can be uncomfortable and sad, but it is part of the life cycle, and we absolutely need hospice nurses. And we have an aging population, and it's a wonderful gift you can give someone is a dignified and comfortable death. So if that interests you, if that's something you want to do, support the patient, support their families both before and after their loved one passes, that is a very, very noble and great nursing career. So then we have the nurse advocate. There's no specific certification for this, but there's opportunities to learn and get different certifications that are related to this job. I wrote down the program for independent RN patient advocates. So that's a certification you could get that would directly relate to this job. So nurse advocates work for the patient, and they are the liaison between the patient and the healthcare system and all the different things that the patient could need. Being in the healthcare system can be confusing, can have a lot of referrals, you know, you have physicians and different specialists telling you different things, and a nurse advocate really comes in to help patients and their families suss out all these options, figure out what their next steps are, and really work in the best interests of their patient. A nurse advocate could make anywhere between $45,000 to $85,000 a year, but I also found it interesting if you want to work, and I'm not quite sure exactly how you are employed, but if you are a private consultant, you can make anywhere from $150 to $200 an hour. And my final one for my BSN level careers is the travel nurse. So this is a very interesting nursing career, I feel, and allows for a lot of wonderful opportunities. So if you are a young nurse, you don't have a lot tying you to one spot, I think that this is a really cool opportunity that you can have. So travel nurses work with agencies, and they're assigned to different care areas around the country and sometimes internationally to fill a short-term gap at a facility. You could have different certifications required depending on what your field is. So if you work in the ICU, your med-surg, whatever, you could have to do a certification for that, but you'd have to look into that for your individual area. So nurses are typically assigned to a location for anywhere between 8 and 13 weeks. I've heard it can be longer than that, but I think it really just depends on what you're doing. And the average salary for a travel nurse is $75,000, but it can be up to $100,000. And also, in addition to that, you get things like travel reimbursement and a housing stipend, plus full healthcare benefits. So if your travel is being taken care of and your housing is being taken care of, your salary goes a lot further because you don't have these kind of day-to-day expenses. Also, travel nurse salaries and reimbursements and stipends and all that kind of fluctuate with the market. So I know during COVID, and listen, these nurses were sometimes like putting their lives on the line, and you really can't put a price on that. But, you know, I was hearing that some nurses were making up to like 10 grand a week, depending on where they were going as travel nurses during the last year or so. So I don't know if you can expect that type of compensation, but I don't know. It's just so appealing to me to, you know, as a young person, a young nurse, the ability to travel to different cities, to experience different parts of the country, and really, you know, have a lot of that taken care of could be a fantastic like post-program option for you. I highly recommend looking into travel nursing. I don't know if that's ever going to be in the cards for me just with my life and my family, but I envy any nurse that's able to do that. All right, let's go to advanced practice careers before we wrap up. The most popular one, and this is just something I feel like I had to include, was a nurse practitioner. So nurse practitioners have either an MSN or a DNP. Some programs require you to have some years of experience. Others allow you to go straight through from BSN to your MSN. I would say I have no experience in this, but my gut feeling says you probably want to work a few years. I know how appealing it is to just keep going sometimes. Like, you're in school, you might as well keep going through to your MSN, just get that done. But I think that you will know a lot more about yourself and who you are as a nurse after you've worked. I think that's really where you find out like what's up. So I feel like maybe before you jump into a nurse practitioner program, something similar, you take some time to really figure out what it is actually that you want. But that's just my 2 cents. Nurse practitioners make an average of $111,000 a year, and I looked up the highest paying cities are California, Alaska, Massachusetts, New Jersey, and New York. Definitely keep in mind the cost of living, so I don't know how much of that they factor into these numbers, because of course you'll be paid higher in California because your cost of living is much higher than say Pittsburgh. So nurse practitioner, their abilities and their independence depends on the state. In some states, nurse practitioners can work independently without the oversight of a physician, and in some spots you need to work under a physician. So I think more and more nurse practitioners are going to gain independence. I think that's kind of the direction that we're moving in. There is a movement of more credibility for nurses in our education and our knowledge level and our skills and ability. So my prediction is that nurses are going to take a big step forward in the coming future, but I don't know. That's just my guess. Then we have a certified nurse midwife. So this is a nurse that specializes in women's reproductive health. I think this is an extremely fascinating career, and honestly, after doing this, I think maybe this is where I'm going to go. I mean, I have no idea yet, but potentially this is what I would like to do. So you need a minimum of a Master's of Science in Nursing to be a certified nurse midwife. Births that include a certified nurse midwife actually show lower rates of cesarean, higher rates of success. So this is a very valuable career and type of nurse that hospitals are looking for, and it's expected to grow. The career is expected to grow by 31% by 2024, so right around the corner. You're going to see more and more job opportunities here. You're going to help women with health maintenance, family planning, pre to postpartum care, so all the way through their pregnancies, and as well as newborn care. So I think that is an extremely interesting career if you're interested in working with women, if you're interested in like labor and delivery, postnatal, prenatal care, all that good stuff. So the average salary for a certified nurse midwife is $90,000 a year, which is higher in California, New York, Georgia, Maryland, and Massachusetts. So if you're in those states, you can expect maybe a little bit higher than that average. And finally, the big kahuna, the nurse anesthetist. You probably have heard of this. This is the highest paid nursing career for good reason. The average salary for a nurse anesthetist is $139,000 a year, but up to $184,000. This is an advanced practice nurse certified in anesthesia. Right now, only an MSN is required to be a nurse anesthetist, but by 2025, they're pushing to have the minimum requirement be a doctorate of nursing practice. A nurse anesthetist literally does the exact same job in the exact same way as an anesthesiologist. It's just one is a nurse and one is a medical doctor. I think they're looking to kind of match that education level, and I think that that is wonderful, because if you're doing the exact same job with the exact same skill set, you should be compensated the exact same way and treated as equals, even though one is a medical doctor and one is a nurse. Like I always say, the nurses have this added component of just holistic patient care. You might be a little bit more hands-on with your patient. If you're more inclined towards like statistics and pharmacology, and you like, working with patients and thinking, being in the OR or something like that would be of interest to you, I mean, this is a fantastic career to pursue. All right, that is all for this video. I hope you found it helpful. I hope you learned something new and maybe found a different career option that might spark your interest. Please let me know in the comments below what you're interested in, what career you want to pursue. And if you like this video, please give it a thumbs up, and don't forget to subscribe because I put up new videos every Monday. I'll see you guys next week. Bye.